All right, let's jump right in. Today we're talking about something that is a real game changer for people dealing with painful benign bone tumors, especially one called osteoid osteoma. We're going to break down some really exciting clinical trials that are opening the door to new non-invasive treatments. So if this sounds familiar, maybe for you or for someone you care about, then you are in exactly the right place. We're not just talking about the old school options here. We're looking at what's happening right now on the cutting edge of medicine. Okay, let's get into it. Okay, so first things first, let's just talk about the challenge here. The word benign sounds pretty harmless, right? But when you're living with a bone tumor like an osteoid osteoma, the reality is anything but. We are talking about a deep, relentless pain that can mess with your sleep, your job, your whole life. And for a long time, the problem has been finding a treatment that actually works without being a massive disruption. For so many people, the reality has been this constant, sometimes severe pain. And the treatments? Well, they've often meant invasive surgery or something called radiofrequency ablation, which is basically where a probe uses heat to zap the tumor. And look, those methods can definitely work, but they come with their own baggage, right? Recovery times, risks, it's a lot to deal with. And that's exactly what this new research is trying to fix. So where's the good news in all this? Well, it's right here, clinical trials. And I want to be super clear about this. This isn't some far-off futuristic stuff. This is about getting access to the absolute forefront of medicine, like today. So you hear the term clinical trial, and maybe it sounds a little intimidating, but really all it is a research study, a very carefully designed one, to see if a new treatment works and is safe. But think about what that really means for you. It's a chance to get groundbreaking care, sometimes years before anyone else can. And this is a big one. It's very often free for the patient. All right, let's get into the nitty-gritty. This is the heart of what we're talking about today. We're going to shine a spotlight on 4 specific clinical trials that are happening right now in both Europe and North America. Okay, so here's a quick snapshot of the big players on the field right now. And what's so cool about this is just how different the approaches are. We've got trials comparing one non-invasive method to another, some testing brand new ultrasound gear, and one that's even looking at a drug treatment. It is not a one-size-fits-all situation anymore. And this is where it gets really simple to understand, which I love. Basically, all these new ideas boil down to 2 main paths. You've got the thermal route, think of it like using focused sound waves to create heat and destroy the tumor, all without a single cut. Then you have the medical route, which uses a drug to tackle the pain and manage the tumor from the inside out. Okay, let's zoom in on those ultrasound options, because there are a few. First up, you've got a trial that's basically a showdown. It's MRI-guided focus ultrasound versus the more standard CT-guided radiofrequency ablation. The great thing here is it's open to pretty much all ages. Then there's the UFO guide trial in Europe. They're testing a whole new system for what's called high-intensity focused ultrasound, or HIFU. Super advanced stuff. And the third one also uses MRI-guided ultrasound, but it's specifically geared towards younger adults. So, 3 really solid surgery-free options. But what if a procedure just isn't the right move for you? Or maybe you've tried something and it didn't work. Well, that's exactly where this zoledronic acid trial fits in. It's running out of a hospital in Paris, and they're looking at a specific kind of drug to see if it can effectively get rid of the pain. This is a huge deal, especially for folks with atypical osteoid osteoma, and even for people who've had other treatments fail. It's a totally different angle on the problem. All right, so you've seen the options. You're probably thinking, this sounds great, but how do I actually get involved? So let's talk about that. This next part is all about the how-to. It's your roadmap to actually taking part. And you know what? It's actually a lot more straightforward than you might think. It really boils down to 3 simple steps. Step 1, just reach out. Contact the people running the trial directly. Step 2, get your stuff together. Pull together your medical file. All your scans, reports, biopsy results. Having it all ready makes everything so much smoother. And third, and this is super important, when you contact them, be upfront. Tell them you're interested in being included for free, and just be open about your financial situation. A lot of these trials are set up to cover the costs. And this right here is something I really wanted to pull out from the source material because it's just so important. Listen to this. If you need help contacting the centers, I can help you draft a standard email in French or English. I mean, how amazing is that? It just shows that they get it. They know it can be a little scary, especially if there's a language barrier, and they're literally offering to help you write the email. It's all about making sure everyone who's eligible can get a shot. Okay, as we start to land the plane here, let's boil all of this down. What are the absolute key things you need to remember from all this? So if you walk away with just a few key points, let them be these 4. First, this isn't science fiction. New, non-invasive treatments are being tested right now. Second, don't let money be the thing that stops you. Getting into these trials is very often free for patients who qualify. Third, there is a clear 3-step path you can take to find out more. It's not some big mystery. And finally, number 4, you are not alone in this. There's help available to get you through that first step of making contact. So I want to leave you with this question. The whole world of treatment for these benign bone tumors is shifting. We're moving from just 1 or 2 options to having multiple paths, from focused ultrasound to new medications. So the question isn't just, how do we deal with the pain anymore? The new question is, which of these incredible new approaches could be the right one for you?